We are back on the Derm Couch, and ExoMind is on everyone's mind, including mine. And people are appropriately wondering, why is P. Frank MD doing brain treatments? What is up with this hocus pocus? What is it? Well, it's not hocus pocus. It is the real deal. And as far as bringing it into P. Frank MD, which we've transitioned not only from an aesthetic healthcare brand, but to an aesthetic and longevity healthcare brand, long before this in 2020, when I released my book, The Pro-Aging Playbook, I really have always been a devout believer that so much of how we look on the outside has to do with a coordinated effort, not only of the things we do on the outside, but how we treat ourselves on the inside. Look good, feel good. They're not opposite ends of the cafeteria. Taking care of yourself from the inside is the most important thing. And for those of you who didn't read the book still, many of you know that I actually went to medical school to become a psychiatrist. So I always bring my psychology training into everyday work. I'm in the self-perception business and making people feel like the best version of themselves, trying to impose vitality into people's lives. We are visual creatures, so what we do on the outside definitely has an impact. But I believe there are so many things at play. And mental well-being, mental health is such an important part. This unique device that came out is not new. It's based on TMS, transcranial magnetic stimulation, which is a technology that has been evaluated by the FDA. It's used for major depressive disorder. It's been around since the early 2000s. This device, the ExoMind, is the second generation. I'd like to call it TMS Lite. It activates a portion of the brain that is involved in mood, decision-making processes, and it's used not only for major or minor depression, but for a long list of mental health maladies along the full spectrum, from minor to major anxiety disorders, obsessive compulsive, brain fog. Who in New York City does not experience a little brain fog, problem sleeping, maybe some obsessive compulsive behaviors? This is really where it targets. So as far as I'm concerned, this device fits perfectly like a puzzle piece. In fact, a very important puzzle piece into my practice. I'm super excited. I've done 4 out of the 6 treatments. It's a much simpler regimen than the older technologies. And I think it could fit into people's lifestyles to improve whatever they need to about themselves or what they're struggling with. It's 6 treatments, 30 minutes at a time. You can do it once or twice a week for 3 to 6 weeks. And so far, we have been seeing great results. I've done my 4 out of 6 treatments. I call it like meditation on steroids. It's very relaxing to get done. You feel great, you feel lucid afterwards, and ultimately energized and just well. And listen, when you feel well, you look well. Man, people get right to the point. Cost. Does it cover insurance? It's an interesting question, because I do believe insurances do cover it for people who have resistant or medication-resistant major depressive disorder. That's what it's FDA approved for. But again, like using Botox for migraines, you have to go through a whole criteria process to prove that you have an FDA-approved major depression, and an FDA approval for what it's indicated for, which is major depression. So for most people who are dealing along the spectrum of anxiety or mild dysthymia, which is a form of depression, honestly, it's not going to be covered by insurance. It is 6 treatments. It's $4,800 for the package, and depending on what people needs, much more cost-effective maintenance regimens can be acquired also. Mechanism of action. Well, we're using magnetic field technology. It's sending magnetic waves to the dorsal frontal cortex. Actually, it's on that side, on the left side. And, you know, you've heard of things like electric shock therapy, which, despite its movie impression of being a very dangerous type of thing, was used very successfully for a very long time. Using stimulatory impulse, electricity and electroshock therapy, magnetic waves in terms of this, can activate neuronal transmission and improve neuroplasticity, which means you're stirring up activity where it's faulty. You're probably changing neurotransmitter secretions. But when you focus these magnetic waves, it almost has like a reset potential. And I think really that's where it stood the test of time in research over the last 20 or 30 years very safely. The good and the bad. Well, the good is it's non-pharmacological. So many people who suffer without even a major diagnostic criteria, people suffer from mental health issues, and they're on SSRIs, sleep medicines, benzodiazepines, anti-anxiety medicines, and a whole variety of FDA approved and non-FDA approved and alternative medicine treatments for the enormous amount of psychological ailment and suffering that's going on. So the great thing is this is a proven, historical, successful treatment that is non-pharmacological. Very much like meditation or exercise, this is a safe alternative. That does not mean that it's safe for everybody. People who have seizure disorders or metal in the brain shouldn't do that. If you have history of severe migraines, you may be able to activate it. Any treatment or medicine that has potential for good does have some bad, but the pros and cons outweigh itself pretty well here. Side effects. Well, immediately, I think the most common one that people say is that they could have a mild headache. I myself felt very relaxed, so if anything, I came out of it a little groggy, but within minutes, I felt pretty energized. I've had the 4 treatments now. My sleep is great. I'm generally in a good mood. You could speak to my staff about that. I'm going on vacation soon, so that may have something to do with it. But I think it's relatively side effect free. It does need to be done in a healthcare facility. You are using magnetic waves. You have to be careful in people who have severe migraines, certainly anyone with seizure disorders, metal, things of that kind. It has to be administered in a medical environment. Again, anything that has potential for good has the potential for bad, but overall the cost-benefit ratio here is really significant. Does this help stop smoking? I think it does affect the craving centers of the brain. It's almost like GLP-1 in a magnetic field. It helps with obsessive compulsive behavior. And I think whether you binge or have cravings of any substance, intoxicant food, I think it is helpful for that. It's not FDA approved for that, but patients have been saying that they just feel stronger and have less tendency towards cravings for most things that they're trying to avoid. So I'd say give it a shot. Does it help sleep? Absolutely. Anything that helps your mental health helps sleep. And sleep helps your mental health. So the hope is that this is one of the multifactorial pursuits that will help our overall sense of vitality, right? Just getting TMS therapy with ExoMind isn't going to do it. Just doing exercise, just eating right, just managing your relationships. I mean, all these things, they are accumulation of the tools and efforts that we make to be the best versions of ourselves. Throwing a little Botox helps too. Keeping your skin healthy. But I do think this is an important piece of the puzzle, and each piece helps the other piece. So yes, I think it'll affect your sleep. That's the short answer. Can you still take other psychotropic medicines, in this case, anxiety medicines? The answer is absolutely yes. You should not start or stop any psychiatric psychotropic medication unless you are under the guidance of a psychiatrist, in my opinion. So if you get ExoMind, it's important you share with us what you're on. It should be an icing on the cake, not a replacement. The goal is, of course, to get off of medications, and something like TMS therapy or ExoMind may get you off medicines, but that should be under the coordinated care of the person who's prescribing it. Never start or stop psychiatric medicines abruptly, and always do it under the guidance of a healthcare professional that is prescribing it and guiding you through it. So that is my very important advice on that. No, it does not hurt. It feels like a little vibratory. I find it very relaxing, so no. How long do the effects last? Well, we'll find out. I do believe there's going to be some permanent resetting. As I mentioned before, how often the maintenance regimen is really going to depend individually. I believe people get an individual immediate response from one treatment, but that kind of long carrying response happens after several. I think it's like exercise, right? you go to the gym once, like you feel pretty good when you get out, but that feeling really good when you get out doesn't stick with you all day long unless you're doing it regularly or you've really kind of put in the workout for a few months. So I think it's true, like something like this.